Assalamu alaikum. I am Dr. Nafisa Rashid, Associate Professor, Department of Pharmacology at the Women's Medical College. Welcome to our online session. Our today's topic is antifolate drug. Hope you will enjoy the class. So, let's get started. At first, you have to know that what is antifolate drug. It means that the drug which exerts their mechanism of action by inhibiting the folate are called antifolate drugs. Now, what are the names of antifolate drugs? Two. That is number 1, that is sulfonamide, and number 2, that is trimethoprim. These two drugs also combine to form a different type of drug, that is cotrimoxazole. I will mention it later or discuss it in the last section. Individually, I will discuss about the sulfonamide. Sulfonamide individually is a narrow spectrum drug and it is also a bacteriostatic drug. That means it cannot kill the bacteria. It can halt the growth and multiplication of the bacteria. And also it has less spectrum coverage, so it is called the narrow spectrum. Now what are the use? The use of sulfonamide is like antibacterial, that is our today's topics. Number 2, it can also be used as diuretics. Which type of diuretics? Carbonic anhydrase inhibitors diuretics are like sulfonamide containing diuretics. Number 3, that is oral hypoglycemic. Oral hypoglycemic, then which type? This is sulfonylurea. You have read this in your diabetes chapter. That is sulfonylurea is a oral hypoglycemic drug that contains the sulfonamide group. And number 4, that is anti-leprosy. Its name is Dapsone. Now, what are the structure of this type of drug? Sulfonamide containing drug has structurally similarity with PABA, P-A-B-A, all are capital letters. That means para-amino-benzoic acid. The other name is pteridine or glutamic acid. Now, how it acts? The drug sulfonamide, at first I have to mention that how this bacterial protein synthesis occurs. PABA will transform into dihydrofolic acid by an enzyme, that is dihydrofolate synthetase, and then again it will form tetrahydrofolic acid by an dihydrofolate reductase enzyme. Then purine will be formed, and which is a precursor of our DNA synthesis of bacteria, and thus protein synthesis occurs. But sulfonamide inhibits the dihydrofolate synthetase enzyme and trimethoprim inhibits the dihydrofolate reductase enzyme. As a result, no purine is formed, no bacterial protein is synthesized, and ultimately antibacterial action. Now, the stages of DNA synthesis is complete. I have to discuss about the classification of antifolate drug. This can be classified into two types. Number 1, it is topical, and number 2, it is oral. The topical antifolate drugs are number 1, silver sulfadiazine and sodium sulfacetamide. Silver sulfadiazine, it is used in case of burn. Different type of burn, like burn from hot water or for flame of the fire. It is nowadays a very regular item cream. We can purchase it from the shop, like Burnol, like Silk Cream, like eBurn. These are very popular and it is a very common antimicrobial ointment nowadays. And another one is sodium sulfacetamide, which is used in case of bacterial conjunctivitis, and it is formed bacterial. It is an ointment. Then I have to tell you the oral type of antibacterial. The oral type of drug can be classified into it is classified into two types. Number 1, it is non-absorbable, and number 2, it is absorbable. The non-absorbable drug's name is sulfasalazine. I know that this type of drug is very hard to remember, and also it is very confusing, the names, but you have to memorize it for your written exam. Now, non-absorbable drug is sulfasalazine. It is used in different types of GIT problem, like ulcerative colitis, irritable bowel syndrome, like enterocolitis, like ulcerative Crohn's disease, celiac disease, etc. Then absorbable type is classified into three types. Number 1, short acting. Number 2, intermediate acting, and number 3, long acting. These are classified according to duration of action. So, short acting is less than 6 hours, and their names are number 1, sulfasalazole, number 2, sulfacytine, and number 3, sulfadiazine. Then intermediate acting, this acts less than 12 hours, that is sulfamethoxazole and sulfanilamide. Okay, and the last one is long acting. This name is sulfadoxine. This sulfadoxine also have an important use in case of malaria treatment when it combines with pyridoxine to form Fansidar. Okay. Then I have told you about the two combination. Number 1, sulfadoxine with pyrimethamine, and it forms Fansidar, that is used in malaria. And number 2, sulfamethoxazole and trimethoprim, that forms cotrimoxazole, and which is an important antibacterial drug. Few days ago it was very available in the shops and named Cotrim. Okay. Now what are the indications of antifolate drug? Indications I have already mentioned, but you have to write in the written, so you have to memorize it nicely. Number 1, local or topical. This uses burn and bacterial conjunctivitis that I have mentioned before in case of topical ointment and also for burn. Non-observable like GIT disorder, that is ulcerative colitis, enterocolitis and IBS. And observable indications are like UTI, like acute toxoplasmosis, secondary line therapy of malaria, and pneumonia in case of HIV patient. Now the adverse effects of sulfonamide. You know that sulfonamide group of drugs are not nowadays are so many used because of they have very toxic effect. Why this toxic effects occur? Because they contain sulfur containing drug. Because sulfur containing drug has some irritation like drug fever, like maculopapular rash, like Stevens-Johnson syndrome, like exfoliative dermatitis and urticaria also. Number 2, it also causes severe urinary dysfunction. What are they? Number 1, that is crystalluria and also hematuria. The crystalluria and hematuria, these sign symptoms is severe pain, colicky type of pain in the abdomen and also spasmodic pain. Then what is the treatment? You should advise the patient to take plenty of water to intake, and also as a doctor you can alter the pH of the urine, like by giving the sodium bicarbonate you can alkaline the pH of the urine. Do you know how this toxicity or hematuria occurs? It occurs due to the metabolism of the drug, because this type of drugs are metabolized by acetylation and they form acetylated transferase enzyme, acetylated sulfonamide, and this is water insoluble or more lipid soluble, so they do not excrete easily. And moreover they forms like prism like structures which has sharp end, and these when go through the renal tissue or renal tubules, they pierce the renal tissue and causes bleeding. As a result, sign symptoms we find hematuria and also crystalluria, also proteinuria, and lastly there is oliguria, and ultimately renal damage occur. Okay, you have to face it during viva. Now disorders of hemopoietic system, this is also important adverse effect. Number 1, it is aplastic anemia. Number 2, it is acute hemolytic anemia and agranulocytosis also. Then what are the contraindication? The contraindications are the patient who are already suffering from renal insufficiency, or pregnant women, or who have hypersensitivity to sulfonamide, and who have also already hemopoietic disorder. We should not give it in that type of patient. Okay, now nitrimethoprim, the second one, all the adverse effects, mechanisms, toxicity more or less are same. The actual difference is they acts by inhibiting the dihydrofolate reductase enzyme. Please don't forget, it inhibits the dihydrofolate reductase and sulfonamide inhibits the dihydrofolate synthetase. Now, when these two drugs combine to form the trimethoprim, what are the advantage? It is a very common question in case of Viva, and you have to mention it, you have to answer it frequently in case of Viva or written or MCQ, anywhere. Like it has a bactericidal effect, it has broad spectrum antibiotic, it has a less amount is needed, less adverse effects occur, and also drug resistance is delayed. We know that drug resistance is a very important topic in case of antibiotic, because drug resistance is a very hot question nowadays, because the doctors faces many problems in case of antibiotic resistance. Then how this resistance develop? By sulfonamide. Overproduction of PABA, the bacteria causes high amount of production of PABA that may cause resistance to this drug, and also the structural alteration of the dihydrofolate reductase or synthetase. The cotrimoxazole actually was used in case of UTI, enteric fever, bacillary dysentery, chlamydia infection, nocardia infection, and also pneumocystis carinii. But nowadays, due to these strong adverse effects, these types of drugs are obsolete, and many new drugs are used nowadays, which has better than this cotrimoxazole. So this is our today's topics. Hope you will enjoy this class and will get some important information from this class, and that will help in your next exam. Okay, bye. Allah Hafiz.